The leader of our college for the past year, our president, Dr. Boulay, will now present the annual State of the College address for you. I'd like to introduce to you our president, Dr. Boulay.
Merci, Colle. J'aimerais vous souhaiter la bienvenue au Forum en médecine familiale ici à Montréal. J'ai le privilège de pouvoir vous apporter quelques mots et de vous donner une mise à jour des activités de votre collège, le Collège des médecins de famille du Canada. Il y a 54 semaines depuis mon inautorisation comme le président de votre organisation à Vancouver. Je peux vous assurer que l'année dernière m'a eu l'air plutôt d'avoir au moins 100 semaines. Une impression partagée par ma famille et aussi confirmée par le volume de dossiers que notre collège a pu poursuivre. I'm extremely proud to be able to take a few minutes at this, the biggest meeting of family physicians ever held in Canada, to bring you all up to date on what your college has been doing for you for the past year. But first, a few broad impressions that I've been able to really gain since becoming president. Our college motto, "In study lies our strength," is certainly as valid now as it ever has been, as our traditional roles of providing comprehensive primary care to all Canadians are strengthened, and as we recognize increasingly the leadership roles that we, family physicians, are taking in our practices, in our communities, to our patients, and to broader and more diverse populations. I like the phrase, "the rise of family medicine," which signifies for me the increasing focus being placed on our specialty and on the increased awareness of what our type of comprehensiveness can bring to our patients and to our struggling healthcare systems. We are at a tipping point. My travels have confirmed for me that governments, policymakers are finally understanding that a model like we have proposed for the coordination and delivery of care to Canadians, the patient's medical home, which I will discuss a bit more later, is their and our pathway to sustainability. And we are increasingly being asked to come to the table to give our opinions. Our college has seen enormous growth over the past decade and a half. We now sit at more than 26,000 members nationwide, and the future of our specialty holds increasing promise. There are now more than 1,250 entry-level positions into family medicine residencies every year in over 120 sites nationwide. Last year, 34% of medical students chose family medicine as their first choice on the CARMS match. These increases have presented challenges for our college. We have had also significant increases in our numbers of exceptional staff in order to maintain the high level of membership service that college members have become accustomed to. These increases in our size have also meant that we have to keep our eye on the governance of our organization. We have to be sure that we can continue to represent members and chapters and to provide a model for governance that appropriately reflects our increasingly diverse membership. To this end, we have begun what will become an ongoing governance review within our college with the creation of a governance advisory committee. I'd now like to touch on some of our specific areas of activity. Our newest section, the section of family physicians with special interests and focused practices, was formed after extensive consultation with our members and with other stakeholders. Its ultimate goal is to increase our support for the delivery of comprehensive care within our one specialty of family medicine. To date, 15 groups have been identified for inclusion into this section. They have all undergone a rigorous process of application whereby they've had to demonstrate to us their commitment to comprehensive family medicine. We look forward to continuing to work with all our members, including those with special interests, to reinforce our college's core principles. On the educational front, The past year has seen the rollout of a new postgraduate curriculum for family medicine, the CCC curriculum. The C's, as you see, stand for comprehensive, continuous, and centered in family medicine. We know and understand the impact this has and will have on our residency programs. We also know that this new curriculum will really enhance our capacity to graduate new family physicians who can work in any community in this great country. Au niveau de nos examens, l'an 2011 a vu pour la première fois l'informatisation de l'examen en médecine familiale et l'expansion du nombre de sites pour notre examen de 12 à 19. Je veux aussi souligner et reconnaître tout le travail fait par notre staff ainsi que le staff du Conseil médical du Canada en préparation pour l'harmonisation de notre examen avec la partie 2 du Conseil, de l'examen du Conseil médical du Canada qui aura lieu en 2013. MainPro, our platform for continuing medical education, continues to evolve in order to meet the needs of our members. At its most recent board meeting held right here in Montreal, the college's board of directors approved that an annual minimum of 25 credits would be achieved by our members so that we can fulfill our mandate of assuring that our members are committed to continuous lifelong learning. We also heard a report with proposed changes that will enhance CPD for all our members. Our next major area of activity, research, has been very exciting indeed. The increasing focus on family medicine and primary care research in Canada, along with increasing collaboration with international partners, certainly signals for me the growing maturity of our specialty. We have to continue and expand upon the pivotal work that has been done by our family medicine research leaders so that we can enhance the already considerable body of evidence that demonstrates to all within healthcare the invaluable role that family physicians must play in the health of Canadians. This year, we released a major vision paper, The Future of Family Practice in Canada, the Patient's Medical Home. This was, and will continue for many years, to be a major initiative for our college. It highlights not only the importance of family practice, but the need for continued collaboration with our healthcare partners, with the end goal being better health outcomes for our patients and populations. Collaboration, not only with other healthcare professionals, but also with policymakers, politicians at all levels, has been a major focus of my activities during my mandate. I have been able to witness firsthand the interest that we can ignite in politicians when we relate stories from our professional lives to them, and when we provide them with concrete solutions to the issues that plague healthcare. A particularly poignant memory for me is the meeting we had with Mr. Jack Layton. What was supposed to be a 20-minute presentation turned into an hour-and-a-half conversation and discussion, and prompted a personal phone call a few weeks later from Mr. Layton to ask my opinion on some healthcare policy issues. I will always remember my interactions with this great leader. I have many thanks to extend, too many for the time I have with you here this morning. This photo, taken at a staff Christmas event at our college, captures our amazing staff at a moment of celebration. It also brings to mind the rowboat model of leadership that I've heard about several times. Those of you who've actually rowed in a rowboat will understand that you have to look backwards in order to move forwards. The past and present of our college have worked together for many years to make this great organization what it is today. I want to extend a special thanks to Dr. Cal Gutkin, our CEO, who has provided me with all the support and more that any elected president could hope to receive. Nor could I have done all that I have achieved in the past year without the support of all the staff and colleagues back home in Nouveau-Brunswick and in Miramichi, my hometown. And then, of course, there's my family, my wife, Bernadette McCarthy, my children, Daniel, Emma, and Samuel, who gave me safe haven and certainly kept me grounded over the past year. I will never be able to thank them enough for all their support. Merci pour l'opportunité de vous avoir représenté et merci pour votre attention ici ce matin.